Hello, hello, hello. This is Tooth Be Told, Dr. Kyle Dumpert.
Dr. Walter Aka, and we have the pleasure of having Miss Sarah Galco with us. She is, are you a rising second year? Remember
Yeah.
back in the day, we used to call ourselves that. We wanted to feel special, like we've
Yeah.
accomplished, hey, I'm a rising second year. It just means that I know a little bit more. So, so you're a rising second year. You've gone through the hell of first year, and now you're going to the hell of second year. But we wanted to get your opinion because last year, as everybody knows, and if you don't, then I don't know where the hell you've been, but COVID hit, and and it changed the whole dynamic of education. And if anybody listens to us, they know that we already think that dental students are already getting kind of shafted when it comes to education and what they come
Right.
out knowing, right?
Right.
So we said, okay, Kyle, you and I, we talk bad about dental students and their education, even though we were dental students at one point. So let's get somebody on there to defend themselves or
Yep.
confirm what we've been saying. So it's either Sarah, no pressure, but you're either going to confirm or deny anything that we've said. If you confirm it, then we'll have you back on and we'll continue to talk crap about dental students. If you deny it, then we're going to stop. No, we're probably going to still continue to talk crap about dental students. So really, nothing's going to change. But no, we wanted to get your background and let us know exactly where you're coming from. Because you and I, we've been friends for a while. Like you were in hygiene school when I was a resident.
Mm-hmm.
Right. Yes. See, this is how old I am. I can't even. I don't remember. but so she was a hygienist and then decided to go back to dental school, and I don't know why. Because hygienists are amazing. Dentalists, we're okay. But so give us a story. What happened? How did you go from being a hygienist to dental, trying to get back into dental school?
Yeah, so I was in high school and I remember them giving us a little booklet that said, here's some careers and here's some salaries and here's some background on how you become these things. And I remember seeing dentist or orthodontist and I was like, all right, that looks pretty good. And I have a sister. I was like, yeah. I was like, okay, that salary looks pretty good.
That's like the most honest anybody's actually been about that.
Yeah, I'm in it for the money.
Right. Usually they're like, oh, I love teeth. I can't wait to caress teeth. Like something weird. But you're like, no, listen, I saw how much they made and I said, let's go with it. So thank you.
Yeah, I really did. I mean, I was particular about mine, but no family background or anything like that. So
Right.
I decided to do hygiene first to see if I thought mouths were gross, which they are, but if I could handle it and if I was into it, and I was. So after working for some good dentists and some not so good dentists who weren't exactly, I don't know. I don't want to say that they were purposely bad. They just weren't good. And I thought, I could do that. I owe it to some patience.
Let's pause. So what do you say good versus bad? Like, what are they doing that's so bad?
So there were some where they weren't ethically straight,
Okay.
but there were others where their hand skills were just not good. And I don't know if it was because of age or if they were just getting lazier, if they couldn't see. But I just started feeling bad for patients that were coming back to have like the same restorative redone every 6 months.
Okay.
So I thought, I felt like I could do it. I always put them on this pedestal of like greatness and intelligence. And I thought, I should try. let's give that a try. So
she's like, I'm not blind. My hands are okay. I think I can do this.
Give it time. Give it time, because I'll look at patients and I'll be like, man, who did that terrible filling? And I look back, oh, that was me. Oh, shoot. So give it time. Give it time.
And then you tell the patient it needs to be redone. Why? Listen, it just does not look as good as it could be. Right? You blame them.
And I was naive once too, but then I had the assistants rat them out, so I was like, okay. They'd be like, I'd be looking at them. I'd say, did you see that over there? Did you get that? Did you see that dark spot? And they would be like, oh, and then they would do it. Like, so I got to the point where I was like, oh. Yeah, that's not ideal, but yeah.
So you're like, you know what? I can do this.
Yeah.
So let me apply to dental school because I can do this.
Yeah.
Okay.
Yeah, it's about time. Let's go for it.
Got you.
So, yeah.
So then you got into dental school, and what year did you start?
Started in 2019, but had to take that little hiatus with some family stuff going on. So I restarted with in 2020 with the class of 2024.
2024. Okay, so you started last year during COVID.
Yes.
How was that? Because COVID kind of started hitting, as you say, shit hit the fan in March.
Yeah.
You were already in your second semester?
I had been working at that point. I had already taken
you've been working. Okay.
Yeah, so I started working during my hiatus before I restarted school in the fall of 2020. So there was all these other my classmates. They were all finishing their undergrad and graduating, and I was working and then not working and just sitting around waiting for it to start.
Right.
Basically.
Okay. So you started fall of 2020.
Started fall 2020.
Okay.
And when you started, like, what did you have to do differently? Like, you guys, I mean, clearly you weren't going back to the school, right?
Right. Yeah. So it's Zoom University. Everything just about was online. We went in, we had like one lab session once a week that we would go in for, and occasional rotations, because as much as we thought they wouldn't bring us in, they also wanted every student in clinic to have an assistant. So that way they were limiting any aerosols that were going on. So that way we were there suctioning the entire procedure and getting patients in and out hopefully quicker. So they did have us on site for that. But as far as the didactic classes, all the biochem and the micro, all of that was online entirely.
Okay.
Well, so I'm kind of confused, I guess. So you started school, then all 80 of you guys, it's 80 people in your class, right?
Mm-hmm. Yes.
All 80 of you guys would go in at the same time, or was it like 20 go in one day, 20 go in another? How did it work?
I would say, yeah, it was probably about 20 at a time. And they would go in and they would disperse us among the diagnosis and treatment planning module, the restorative module, and the PROS module. So I would say they had us come in by our teams. They would say, okay, teams 1 through 3 come in today, and then they would assign us students who had patients coming in.
Okay.
Based on that day.
And we talked a lot about vaccines on this on different episodes. And now there's a lot of discussion right now between staff that want to get it, don't want to get it, how we're able to require staff to get it or let them go. What was your experience in dental school as dental students? Were you required to get vaccinated to be once it became available? What did that look like?
Yeah, no, we weren't required to get it. It was like strongly encouraged. A lot of the staff, openly talked about getting it. So it was something where everybody was itching to get it, though. They would send us links for different sites that we could go get vaccinated, and people were rushing to schedule. So it seemed like, for the most part, the majority of people did. But yeah, they haven't required it or anything yet. It's just been encouraged so far.
Okay. And how do you think that your school did when it came to, making sure that you guys were safe with enough PPEs? Because that was the biggest thing that, if you were listening to like a few other episodes during the COVID time, Kyle and I would talk about, our offices aren't open, we can't get PPE. We're trying to figure all this stuff out. Like, how did it look when you guys came back?
Yeah, so they were pretty on top of that. We never really encountered a shortage. I think during our week of orientation, which was virtual, but we did go in for like CPR that same day. They fit us for KN95s, and they gave us, I think we got 2 for our rotations, and then we were assigned ones that were specifically for sim clinic and like the wet lab. So they were marked with these blue stripes, meaning like you do not wear these in patient areas. What the difference is, I still have no idea, but they designated that we had some that were strictly for that and strictly for patients. And they gave us enough so that you would, put yours in a brown paper bag for 3 days, and then you could, have another one for the next day. And they made sure we had enough to cycle through them like that. We still wore the face shields, and they always have had a gown. So we continued with that. So yeah, they never really expressed that there was an issue with getting PPE there. I'm guessing that by the time we got there in September, they kind of overcome whatever shortages there might have been.
Right.
But as far as I know, they told us or at least the one dean had mentioned that this dental school really only shut down for like a week or two in the entire pandemic. It was like at the first week, and then they opened up the emergency clinic. So they were actually always had somebody available for almost the entire pandemic. So they seem to have kept on as close to business as usual as they could. So I'm guessing they didn't get hit too hard by that.
Right.
But
with private practice or dentistry in general, we were all passing on a PPE fee, and a lot of the insurance companies were coming out saying, we'll give you an extra $10 per patient for PPE fee. Dental school, if it was anything like when I went to school, it was, you're going through a lot of PPE. You're supposed to take off your gown and not reuse the same gown per patient. You're constantly throwing gloves away. Did that change at all? And with dental school being so expensive, did the dental school try to pass any PPE expenses on to your tuition? Did you see any tuition changes or expense changes, or were they passing any of those expenses that of on to patients at the dental school?
Yeah, I'm not sure if they did that to the patients. I didn't hear about it. And they don't really have us present when they do sort of that financial presentation to the patients. Usually that's already done before we would see them. As far as as a student, I don't believe I saw it. People in my class were more mad for some of the lab fees that we were charged.
That's where it was. It went to your lab fees. I can tell you that.
Yeah. So for the spring semester, we were in gross anatomy and head and neck anatomy, and we never stepped foot in a cadaver lab, yet we were still charged the cadaver lab fees.
Yes.
Thousands and thousands of dollars for a donated cadaver.
Yes.
Wow, that you didn't get to touch.
And
you didn't even touch at all.
No. The faculty, they used one. They chose one, and they took pictures and videos for us of showing us where things were, which I think is better because I don't need to waste my time cutting through a cadaver, not even knowing what I'm looking for, versus them already kind of having it laid out there for us. Well, but we all paid thousands of dollars in cadavers.
The hours I spent in anatomy lab, hours,
I didn't miss that. I didn't miss not spending hours there.
But you know what, though? Here's a little. I'm gonna kind of defend the other side, right? Some people learn by actually doing, right? Others learn by watching. So I feel like you've eliminated half of the other people. Well, mind you, you guys all got charged, right? Yeah. So despite everything, you guys all got charged for this. But some people might actually do better by going in and doing.
Honestly, it's the only time you can do surgery on a human body that you don't have to worry about messing up.
Okay, Kyle, that's a good point. That's a very morbid point, but that's a good point.
It's serious. It gets you comfortable cutting on skin and going. I mean, I'm not cutting through muscle or anything on a daily basis for my job, but getting into bone, reflecting flaps, and all that stuff. So I think that I would hope they would let you get back in there and use those bodies.
Well, it's too late now because she's a second year. That was all first year stuff, right?
So they told us, well, this is the kind of weird part, is while we are in the class, we are in head and neck anatomy. Mm-hmm. That started in mid-March, which is the same as it would have been for the class ahead of us. Right. So the pandemic started right when they were entering that class. Okay. So they had done gross anatomy from the neck down, but they had never actually been in the cadaver lab for head and neck. So whenever we are in the class, they sent an announcement out to them saying, hey, we're going to open up the cadaver lab so you guys can come in and, do some head and neck dissection if you would like, since you didn't get the opportunity to last spring. Where was our invite? Well, you didn't get an invite to do that while we were taking the class. But they offered the second years the opportunity to go in and make up that part, basically.
So you guys didn't get a chance to do the head and neck dissection, but the year ahead of you could come back and do the head and neck dissection.
Yeah.
Huh.
It was really bizarre because they said, we'll offer these open lab hours and you can come in and do this. And all of them were like, no. We're kind of past that part now. Like we're in RPD and FPD and endo. Like this is not a priority for us now. And the rest of us are sitting here like, well, we have time. We're learning it right now. And it never came around. So I don't know if they're going to ever offer it to us. But
I could see this being like a really exclusive club where first year comes in, can I go cut up? Shut up and get out of here, you loser. You know, what are your first year? You know,
Right. Yeah.
but I just want to learn. I said, get the hell out of here. Now you second year. I know you don't want to do this. Get in here to have fun. You know.
Yeah. You know, all of
That
us, there were
makes
people
no
who
sense.
they would come up with the craziest ideas because they would say, well, if you have an idea of how we can all be in the lab and socially distance, let us
Right.
know. And people were brainstorming like crazy because they did want to get in there. One, because they're paying for it, and two, because it's part of the experience. And especially for head and neck, I think that is particularly helpful.
Yeah.
To,
Absolutely.
to be able to come into it, to be able to see all these different layers. So
Right.
for me, having them do it and have it very nicely done and identified for us was nice because I did save that time.
Right.
But I do think being in person for that would have been helpful. But I was glad that they tried to supplement it for us, but it definitely wasn't the same. It wasn't worth the thousands of dollars that it cost us to look
Yeah.
at these
So-
little video clips.
So I'm guessing for your exams, they would just basically take like screenshots of like what they showed you guys and pointed to the stuff and said, "What is this?"
Yeah. So, and well, that was the thing. They didn't even do that for head and neck. They did it for gross anatomy. It was
Okay.
40 like questions based off of systems. And then there were 40 practical style where she had, we either used cadaver images that were in like the museum part. I don't know if you remember that.
Oh, I remember that.
Mhm. Yep.
Yeah. So like in the
Yep.
museum part, that's where they had, that's where they had taken pictures from. And
Okay.
then we use what's called, Body Atlas or something like that, and it's a
Yeah,
3D
yeah,
computer
yeah.
version. So I would say it was about half and half, where they would also choose those and they would isolate something and it would highlight it, and they would say, "Okay, what's this?"
It's amazing to me that you guys had a body atlas because I still have that book, but it wasn't
Yeah.
3D. It was actually like paper, and I had to
Yeah.
read it. You know, I couldn't rotate it. It's it was
It was
yeah.
cool though because if you clicked
Kyle,
on
I
a
want to
part,
go
it
back
would
to
tell
school
you,
just so I
right?
can experience
See that?
3D. You know,
Yeah.
I had a book.
It was
You
so
know?
easy because you would click on something and it would tell you everything that connected and what systems ran through it. And you could see the motion. You could see motions of joints
Oh,
and
wow.
stuff. It would do it. And I had interviewed at a school where they actually, they had a cadaver lab, but it was all virtual. It was literally a computer the size of a table
Yeah.
that would fit a person. And that was how they did their cadaver lab. So it kind of felt like a mini version of that.
I want to say that might have been Case Western because I heard that their new dental school had like a 3-dimensional like rendering of like bodies that they could like cut through and everything like that.
Yeah, this was, I think that interview was at Western University in LA.
Western, that's LA. Yeah.
Yeah. Yeah.
That's
Okay.
awesome. That's awesome. Okay, so let's fast forward to the part where you're paying for stuff and you're not getting the stuff. It's kind of like I paid for pizza, but I didn't get the pizza, right? And they're like, well, the guy behind you, the guy in front of you is going to get your pizza, but you're not going to get the pizza. So
Yeah.
it's basically like that, right?
Yeah.
It's like we decide to give it to the other person, and if you get it, so what? If you don't, it is what it is.
Wow.
Okay, so so now you've taken anatomy. You're going through that whole process. How did it feel whenever you were taking exams? Like, how did that all work out? Like for me, okay, so imagine if I'm in class and they're like, "Oh, you got to go online and take an exam." To me, that sounds like an open book test. You
Right.
basically just told me I can do an open book test, right? I mean, Kyle, tell me if I'm wrong.
Yeah.
But
Yeah,
if someone
absolutely.
says take a test online, I'm taking an open book test. How did that work out for you guys?
So, being that I had friends who were D2s, and then there was me as now.
Wait. So don't incriminate yourself on
I
anything here.
definitely will not. I will not. I will not incriminate anyone.
No, what I'm saying is like, was there anything that allowed you guys to make sure that you weren't using your books, weren't using notes and stuff like that?
Yeah. So I had been, hearing about what my friends' exams had been like, and they weren't being proctored, and they had free range
Oh, wow.
to navigate the test as they wanted. We show up as D1s, and they're trying to proctor us. They take away backtracking, which it's like any educator ever says, well, backtracking, being able to navigate through an exam, that's a test-taking technique.
Mhm.
You're supposed to go through and find the easy ones, and you can flag the ones that aren't so easy. And
Yeah, that's how I took
us.
exams. I would just go
Yeah.
through and answer the ones I really knew, and then come back and kind of
Yep.
answer the ones I
Yeah.
didn't know.
So that was taken.
So you're not allowed to do that. You're not once you pass that question, you couldn't go back and think about it again.
And of course, it's timed. So you had to try to pace yourself because you had questions that were going to be really, really hard and you were going to get stuck on them and you had to pay attention to the time because you couldn't go back to it. So they did kind of introduce these parameters that did make it more challenging. But yeah, they had ones where we had to have a second device and they would proctor us. There were ones where they would proctor us. That, I guess they decided that they would allow it to be open note, but they would proctor us to make sure there was no one else in the room or you weren't talking to anyone.
How do you proctor somebody to make sure there's no one in the room? Like right now, really, I'm sitting in front of you, right? Mm-hmm. I'm talking on Zoom, on this. I could have somebody right in front of me. You would not even know. They could be holding signs up. You would never know.
They could. Right? So they were just trying to make it harder on you. So you had to be a little more discreet with your signage and how I'm looking at you, I guess.
Yeah.
But yeah, because they also knew that there were people who have roommates that are in the same program.
Okay. Right.
So they might both be in the living room taking it.
Right.
And, so I mean, if you're going to try to swindle your way around that, then you got to be pretty sneaky. But, they're not, administration's not dumb. They knew that if they had enabled people to be able to use their computer, like it wasn't locked down, they still had internet. Yeah. Everybody has MacBooks. Right. They can message, and the people that are in the room with them. And the school would never know because the software didn't monitor that. But that was sort of Pitt's stance as soon as the pandemic happened. They said, we've been bombarded with all these test taking companies telling us how they can monitor eye movement and, all these different ways to proctor. And they said, that is so stressful. This is already stressful enough. Yeah. Like we're leaving it up to professors to utilize the software we have how they want to, but we're not going to add all this extra stuff. We don't want students to be stressed out because some people, they look at the corner of the room when they're thinking and they thought we don't want because that's going to flag them that they're looking at their screen. Right. So they did kind of keep that in mind that it does make it more stressful for those who are doing the right thing, but just don't stare at the screen the whole time.
Well, I guess I have a question again, and then Kyle, anytime you want to jump in, because this is like crazy to me. Why didn't they just bring you guys all into like a room with a bunch of computers and take the test and then leave?
Social distancing.
Yeah. You literally had a whole school, and I remember the dental school was huge. You could separate like 40 in one room, 40 in another auditorium, separate yourselves. You have the computer in front of you. You take the test like we do for the DATs, the part 1, part 2 boards, right?
Yeah.
Because there was one person that monitored us, kept track of what we were doing, right? You went to a designated testing center.
But then you're getting on buses, public transportation. You're being exposed coming into school, leaving school, maybe.
Kyle, let's be honest. You know darn well people are driving around taking buses. Like they're not just sitting at home being good little boys and girls. Let's not pretend that this is what's happening. So I don't understand. Like to prevent all this like high tech BS, why don't you just bring them in and put them in front of a laptop? Which laptops are so cheap now. And when I was going through dental school, it's like $1,000. Now it's like $5, I'm sure. And just take it that way.
We had one class and one exam in that class that they did that. But so the auditorium that would normally hold over 100 people, because it was at 25% capacity, it was only holding 25 people. Right. So they would have needed 4 rooms and they would have needed 2 to 3 proctors per room. And it became a big scheduling issue, basically, between this, which is kind of bizarre because you think, well, no one's doing classes.
What are the other people
site.
Doing? Yeah.
Right. What are these other rooms used for? But that honestly seems like what it became was being able to reserve all these rooms at the time they needed to take the exam. There's people with testing accommodations that would need more time, finding all the proctors to do it. So that was why they sort of did the online proctoring at first. But the one class that we did that for, I could tell the professor was so stressed. Just trying to coordinate all of it, because I don't really think administration was stepping in and helping them. I think they said, well, if you want to do this, you need to find all the professors who can do it.
Or honestly, I'm surprised they didn't switch just to a pass-fail, because I know a lot of dental schools are going to a pass-fail. So, who cares what score you get? You're not being ranked anymore. It's pass-fail. I think that would have been, if that's their ultimate goal in moving the education platform, that would have been a good time to do it.
Right. And we a lot of people talked about that. with a lot of our classes, people said, why don't we just make it pass fail? Why won't they just do that? Because it would have taken a lot of that away from it. And a friend of mine in my class now was struggling academically. They have a lot going on in their personal life, and the university was on the verge of basically dismissing them from the program. And they were like, whoa, time out. Even the provost has said in their emails that GPAs are going to suffer. People are going through this transition, and maybe online schooling isn't for them. So it was like the fact that some people, their academic career was based off of a semester of school in a pandemic, and maybe that type of learning isn't for them, or that test taking scenario isn't working out for them because their GPA might be 0.03 away from the deadline, the guidelines that they want. So it really does make sense to make it pass fail, but I don't know why, some schools were so adamant about not doing it. But I think it makes more sense.
I read somewhere that students, and I think they only looked at like middle school and high school students, they were saying that last year, 2020, the failure rate jumped to like 50%. Mm-hmm. Right? Because these kids were stressed. Like they didn't know how to do stuff. And it's not even just their fault, right? Sometimes you'll go into like a lecture and they'll kick you out, or you'll go take a test and they'll kick you out, or you won't be able to upload, download. There's so many other factors that go with it, man. So it really seems like you guys were also going through the same kind of stress.
Yeah, I think so. I mean, I had one exam where it was, I think, a gross anatomy exam where there's 40 images. And the way that the images were uploaded to the exam on my computer, my computer screen's only, I don't know, let's say it's 13 inches, but some people have 15 or 17. Like a third of the images were cut off.
Oh, wow.
And I had to call the professor and say, I'm trying to take this exam, but I can't see the images. Whatever your arrow is pointing to, it's off my screen.
Oh,
so
wow.
that was very stressful for me because now I'm, trying to do the other questions on this exam, but I have all these images that I can't identify. And she goes, okay, well, I'm going to email you a PDF of the images and you have to fill it out and send it back to me by this time. And she sends the email and the attachment's not there. I mean, it was a whole mess. It was so like, I can't imagine, for me, I was just kind of like, well, this isn't my fault at this point. They're going to have to figure it out. But I think I'm also one of those people who I like, if they try to come at me and say that I did something wrong, or I would fight them. But I think there's a lot of people that are a little more passive who would just be like, oh, okay, yeah, you're right.
She said, come at me, bro.
Come tell me my computer isn't compatible. Like it's a year old, So I was like, I'm not afraid to stand up for myself. But luckily there was some, or I would say most were flexible and understanding of the situation. Right. And it was a learning curve for them too, to be administering these exams online, because ones where it would have pictures like that, their method would usually be you're in the auditorium and they put it up on the screen and they have you write it down what it is. So it was kind of a learning curve for everyone. So for the most part, people were understanding, thankfully. But I think taking the exams was a big, I would say it was a sore spot for a lot of people to talk about. And they're all showing their skewed bell curves now where it's all up in the A range. And they're like, my class has always been really hard. I don't know what happened. And you'd be like, we're just a really smart group. I'm like, should I make the questions harder? No.
We didn't have anything else to do other than study. That's all.
I mean, and I would always remind them that because it's true. We save so much time. We're not commuting to school. We don't have to pack lunches. We're not sitting with these breaks in between classes. We have good audio. We have good quality recordings of things of the lectures that we can reference, where if you were trying to reference one that is done in person and you hear the professor like on the other side of the room, so it was the whole thing, at least for me, I felt was a lot more efficient when it comes to studying when you're, taking 29 credits and 20 of them are didactic. So I preferred this way. I thought it was a lot easier as far as managing your time with everything that we had to do.
So Kyle, I'm going to ask this question, Kyle, you're going to get irritated. Because I was when I actually found this out. Let me know how your lectures were. You told me something that really blew my mind. You were talking about the lectures being, it was a video lecture, but you could also have subtitles.
Yeah.
So imagine, Kyle, when we were going through school, there was no subtitles. You had to sit in the class. You took notes. If you missed something, you look around, go, what did I miss?
What? Yeah, it's gone. Yeah, you're focusing on one thing, and And
they actually could rewind. They had subtitles, right? Tell me more about this. Like, this blew my mind. I was like, if you guys don't all get A's, I'm gonna beat somebody. I'm gonna tell them to, come at me, bro.
Honestly, we would take recorders to class, and some of the professors wouldn't want to be recorded because you could kind of prove something they said or didn't say and didn't like that. So now you get, video, audio, and subtitles whenever you go. I think that's a huge tool.
And that was something I could kind of compare my first semester to, where it was completely normal versus when I came back and redid that first semester in the pandemic, was that, that was one of the things I struggled with and I hated was, you're just frivolously, you're like that Jim Carrey meme where he's like hitting the keyboard, right? When you're in lecture, because you're trying to keep up with what they're saying. And if you miss something, you're looking at the person next to you. So you're always behind. And you're not really listening to what they're saying. You're just typing what they're saying. So I felt like it was a lot more efficient to have that where, they had some software that they initially had up was awful because they're saying all these scientific words, all these dental words, and like it had no idea what they were saying. But then in the spring, it sort of updated a little bit and we had subtitles that were very, very accurate. So you could either turn on the subtitles and have them scrolling across the bottom, or you could set up on the side of the screen the full transcript. So if you were taking notes and you missed something they said, you could just look at a couple lines above and see, and you could save those transcripts. And when they upload the recording into their software for reference later, it would have that transcript with it.
So what's the point of taking notes? I have the notes.
I know, right?
I would have been like, let me just listen because I already have the notes. I could just read off of that.
Yeah. And I mean, for me, that was how I liked it, because it was like I could actually listen to what they were saying and I wasn't worried about the notes. And, if they said something that maybe wasn't on the slide, I could jot that down if I wanted to, or if I could just reference it later. But for me, typing while they're talking and trying to keep up was not a way of learning. This was a way of learning for me. So it is a little nerve-wracking to think about going back and not having that anymore.
I remember, like, for us, we hired somebody in our class, paid them to take notes for everybody.
Right.
Yeah.
Because they were like the fastest writers or whatever type. I think we wrote at the time back in my day. We didn't have computers.
Just come on, make yourself sound a little more ancient.
Right. No. I think we had typewriters at the time. So they were very good typists. But no, that's what we did. We actually had somebody who could just write the notes really well. We just all paid them, a certain amount, and that's what we had for the semester. So, for you to have all that, that's incredible.
How was the social aspect? Because going through dental school can be a very traumatic experience, and as you're all there together in class, going through the labs, going through lectures, venting to each other after exams and stuff, you bond through that process. But if you're all kind of segregated in your apartments or whatever, did that affect your class at all, do you think?
No more happy hours is what he's asking.
Yeah. So it's been detrimental, but at the same time, I think it's kind of been beneficial because, we didn't have that orientation week where we all sort of, you got shoved at a table with people and they had all these orientation week events, the happy hours, the Pirates, the baseball games or different events. They didn't have any of that. And someone tried to plan something and they got tattled on within like 45 minutes by some narc in the class who, was like, because they told us, they said, we're not having events. We don't want you guys to be getting together right now. And they were just like, hey guys, what if we do a picnic at Shenley Park? And then they got a call within like 45 minutes that said, be smart. You can't meet up. And if you're going to do it, don't talk about it in a group chat with 80 people. So
snitches. There's snitches everywhere.
The snitches. Yeah. So I think it was kind of nice because you were in your rotations or in your labs with less people. There was maybe 15 to 20 of us. So you got to know that group really well. And maybe people that live in the same apartment building, or in the same areas got to know each other a little bit. So maybe through the person that you met in lab that you get along with, you meeting the people that they know. And I do feel like my class is really, really friendly. Yeah. I think everyone is just so excited to be meeting people and to be like getting to see people that are usually black boxes on screens to them. So there is like this enthusiasm that is still going. It feels the same as it did day one of the class trying to do things and getting to, and being invited to, now that we are allowed to do things, being invited to different things on the weekends. It feels very inclusive. You weren't forced into cliques during orientation or those first couple weeks of school. Like, you were in these small ones, but it wasn't the entire class. There weren't groups forming so early on, I think. So that's what I found to be beneficial, is I think I met and hung out with a lot more people now than I would have in the more traditional setting, because you kind of find like the couple people you get along with and you cling to them, and you're like, okay, we're going to study and we're going to sit in class together and we'll eat lunch together. Like, no, because when you're there at different times with different people, you get to know them more intimately, but not, and not be so overwhelmed by the experience. So I liked that. I think it was maybe hard at first, because when everything is, when you have the snitches and everything is like, there's digital proof of everything, you have to be, right? You have to be careful of, what you say and who you talk to. But it was nice. I also think in our generation too, because I'm gonna separate myself from the 22 to 24-year-olds as
okay, you're a baby. Calm down.
But,
calm down. All right, until you had a typist, you're a baby. Okay.
But I feel like we're already used to screens, so having sort of a digital interaction before an in-person interaction made a lot of people feel more comfortable.
Okay. It sounds like I would have failed dental school now. I mean, all this digital stuff. I'd be like, okay, wait a minute. What is this? Zoom? What is this? What are we talking about? I'll be the one that I couldn't even like see the screen. My outcome on it would have no picture. It would be embarrassing.
But yeah, I think that overall it was definitely better for me to have it, to have everything on Zoom and to meet my class in sort of a more gradual way over the past year. I mean, I swear there's probably still people I've never met or I've seen, but I don't realize who they are. But the people that I have met, I feel like I know pretty well, because, if you're stuck in the same lab with them and 10 other people, and everyone's so excited to see each other because we've all been stuck in our houses alone or with a roommate for months, then people are, they're kind of itching to socialize too. So it's been, for me, it's been a good experience that way.
Okay, well, there it is. So you've had a good experience, but can you tell us some of the people that you've talked to that literally had like really bad experience with this whole situation? Because like you said, being at home by yourself, some people just can't do that, right? Being on a computer, some people can't do that. I mean, a bout of depression and all these other issues, I'm sure have increased based on what I've read. Like, I'm so lucky I don't have like teenagers or anybody that has to do homeschooling for the past year, because one, I wouldn't want them in the house with me, and two, just to have to switch everything over to doing it yourself and be more involved in like the teaching of the kids and yourself, that's got to be tough. So like, what have you heard from your classmates about how difficult it was for them?
Yeah, from the people that have seemed to be unhappy or struggle in one way or another, it seems like maybe being at home and having lecture, it doesn't keep their attention as well, or they don't feel like they're as inclined to be regimented in what they're doing, because if you want to go get something to drink, or you want to go talk to your pet, like, you can just get up and walk away. So I think for some people, the fact that, and they're at home all the time, it started to feel kind of restless, where you're like, well, I'm not obligated, right? I'm not in school mode because I'm not in the building and I'm not sitting there watching the professor in front of me. So I think some people had a little bit of a harder time adjusting to that, or even separating that sort of work-life balance where, because you can put yourself in school mode when you're there and study mode when you're home, and then take care of your house and your family, that all sort of blurred into one. So I know for some people it was a lot harder for them because they did have their home life around them. And it was like either they were studying more than they, all the time because it was hard to step away, or they had trouble doing it because they couldn't make that separation. And some people just learn better, I guess, having the professor in front of them in a classroom. For me, I don't like hearing people type. I don't like hearing them knock over their water bottles and letting them roll to the front of the auditorium. To me, there were all these
open
things
their bags
that I
of
was
chips,
like,
crinkle
Right.
the wrappers.
you got the girls behind you the whole
Giggling.
time, and you're like,
Yeah.
what are you doing? So for me, I felt a lot more distracted not having the people in class, but they felt more distracted being at home. But I think another sort of area of frustration, which I have just come to accept out of education these days, but they felt like the school wasn't really on top of what they were doing. Their communication wasn't that great, and I guess I give some credit to they were figuring it out too. This was a new thing for them, but I think some people's expectations were a little bit higher than that. So there was some frustration there, and why isn't administration doing this, or why am I being charged these cadaver fees? And I'm not actually using them. But
You're
yeah,
upset about that. I can tell.
We are very upset because they did. The president and vice president of my class met with administration, not just in the dental school, but on campus in general. And they were like, the money's already spent.
Huh?
And they were like, yeah, but that's not like, I didn't spend it. You spent it. Just because you used it doesn't mean that that's, you should have, and that I wanted you to use it. But yeah, there's some people who said, or they felt like they weren't used to taking exams online. That seemed to be a thing for a couple of people too, that I was surprised by, because they like being able to write in the margins or they didn't have to worry about backtracking or not. So there are some people who I think are a little more traditional and would have thrived more in that situation. But like I said, so far everyone's still here. So, they learn to adapt just as, as I would have had to adapt to being in a classroom and not having my captioning anymore. So yeah, I think there's pros and cons to it. I think the con mostly being the fact that, it's awkward to not really know your classmates at the end of your first year, and that maybe the lecture type isn't how you, feel successful. It's not something that you feel like you can really vibe with. Yeah. But yeah, I feel like there's more who liked it versus didn't.
Are these changes sticking around now that things are going back to normal? Are they still offering those, video recorded lectures with subtitles?
Right.
So right now the plan is to be back on site in the fall for everything, which I'm a little sad about because I think I will lose them. Yeah. They have been recording the lectures for years, like when they're done live in the room, and they upload them so you can reference them later. But it is nicer having the professor talking directly to the computer, because if they are walking around, you might lose that audio. And the captioning, if it even existed, which I think for the most part everyone started doing it before we were even on Zoom, but it wasn't always accurate. So, but like the live captioning will not be there anymore because they won't be using Zoom. They'll just be using whatever the school computer uses to record the lecture for later. So the plan is to go back, and it's going to be how it used to be. And so I think we're going to lose a lot of the benefits that came with doing like that.
I hope you guys as a class can come together and kind of push the school to maintain those, because there's a lot of changes that happened for COVID that I think helped to push not only dentistry, but education, things that as technology has improved all around, everybody benefits. So it just gives people like yourself a different, a different way of learning versus that traditional in class. So everybody doesn't learn the best in-person lecture. Everybody doesn't learn the best on webinars. So by having different options available, I think it would benefit the whole student population for learning what best suits their needs.
It's funny, Kyle. In med schools, most med schools, they don't even have to go to class.
Yeah, right.
They don't have to even go to class. They literally can just watch it, like you said, online. They can go look at the video. And I remember my sister-in-law was funny. She was like, when I was in med school, I would just basically play the lecture back, but like at 1.5 the speed. So that you would just like go through and just like, okay, cool. Yep. Got that. You know what I mean? Yeah. So you made something that was like maybe a 60-minute lecture into like a 40 or 35-minute lecture, so you could get the poignant points. that you were looking for. So I actually agree with you on that. Like, I feel like, at least when I was going through dental school back in the day, we were treated like little kids, if I have to be honest. Right? You had to come in,
had to sign in,
and do all this stuff, and it's like, okay, one, you're ripping me off because you're charging me a lot of money. At least respect the fact that I'm an adult now.
Right.
So that's something that I agree with you, Kyle.
Yeah, I would say from having friends who are working and seeing how their jobs are still going to maintain what they've adopted during COVID as part of their normal work day and workflow. A lot of people that I've talked to, when they're talking about going back to in-person, on-site everything, are kind of mad. They're like, listen, if I'll come in to take the exams, but don't make me come in for lecture. And every professor comes, they log on for Zoom and they're like, I really wish we were in person, and the rest of us are like, we don't.
That's for you.
Yeah, but they really, at this point, they've adopted a little bit of a hybrid model now, because there's 2 days a week we have lab, from 8 to 11 or 9 to 12, but they have that 1 hour of lecture either right before or right after. So you're invited now, you're allowed to stay on site and sit in the auditorium, and the professor will come and do that lecture. I think that that's a fair way to keep doing it, where if somebody wants to go in and the professor, they get enough attendance where enough people want to go in and sit there, then great, go do that. But I still think that they should do Zoom and let people do it from home. I don't think that we should all be forced to go in. But yeah, no, the dental school has not changed as far as attendance goes. And what the one professor is doing, because he has these on-site lectures right after or right before the lab, he looks at the people that are there and he brings an attendance sheet and he calls out names of people that aren't there. So he has little questions on his slides, and he'll say, hey, Sarah, are you there? And then he'll ask them a question. And that's kind of his way of keeping people in check. And there's some accountability for the people that are watching on Zoom to make sure people are there, which I guess for a class like restorative, it is pretty important, but again, you can watch it back. But they started doing little things like that. I mean, I would even...
What's the point to that, though? I don't understand.
Make sure you're there. If you're not, then you lose 2 points from your grade if you don't answer. It doesn't matter if you're right or wrong. He just wants you to answer if he calls on you.
It's about control.
Yes.
That's what it sounds like. It literally sounds like he has too much time. I'm going to say he. I don't know if it's he or she, but has too much time on their hand. I don't want to be canceled. So he or she, that's respectful, or whatever they want to go for, whatever noun, pronoun, But that to me, that makes no sense. Again, I'm paying you guys. You're getting your paycheck. You're doing whatever you need. Why do you need to do that? That makes no sense.
Yeah.
Golly, this is why never mind, Kyle. I'm not going back to school. That'll piss me off, and I'll be sitting there doing what Sarah does, talking about, "Come at me, bro."
Well, I was asked a question during lecture. So there's two professors that'll do that. The one, he just calls on people who are there who are black boxes, and he calls on me and asks me to identify this. Basically, it was a dissection of a lung, and it was a purplish looking lymph node. And he goes, "What do you think's going on there?" I was like, "I don't know." He's like, "Yeah, that's a few chapters ahead."
What?
Well, then why did you ask? What was I? You know what I mean? I was like, I have no idea. And he goes, "That's okay. I wouldn't expect you to know." So why'd you call me out?
Yeah.
like why was this where you decided to ask a question and
I would have just BS'd him. That looks like a chronic inflammatory response, as you can tell by the reedy pegs, And he'd be like, "What the hell are you talking about?" Exactly. That's how I feel about your stupid question.
But yeah, I do think that we are in a professional school. We are definitely still treated in that way where they want to take attendance and they want to make sure you're there. And I guess as far, from a patient care standpoint, they want you to know what's going on, and but that's on the person. And if they aren't paying attention and they're not studying, and it'll catch up to them. Yeah. Right. Professors will ream them out in clinic if they don't know what's going on, if they don't know what they're talking about, or they don't know what they're doing. So I think that, it's a double-edged blade, right? Because it's like, you want to give people that independence, but at the same time, is it going to catch up to them later? Is there going to be, more negative repercussions than positive? But I would like to keep going how we're doing it.
Right. It's funny. My children's daycare doesn't even take attendance. Like they just want to make sure that I pay them. They keep track of that. They're like, where's that bill? You know, but they can care less if my kid is there. They can care less. There was one time they actually, like we were like, oh, let's go on. I was home and my wife was home, so we decided to go to the zoo or something. Didn't even know. The next day I was like, oh hey, they're like, oh yeah. Did they have fun? And I'm like, yeah, you had no idea that my kids were That's what
I have a friend when he's off work, if he has projects to do that day, if he's off on a Wednesday, he'll take the kid to daycare. They charge him the same price Monday through Friday versus 2 days a week. So it's like he's like, if I got stuff to do, I'll go drop him off for a couple hours.
That's right.
And get my stuff done.
The only thing they care about is I'm paying the bill. They can care less if my child is there, has learned anything. It's like the swimming class I take them to. I have yet to see any progress or whatever. I'm not upset about that. I still swear to God, I watched it. I'm like, you haven't learned anything in 2 years. Oh, good for me. But anyway, Kyle, do you have any more questions, or should we just wrap this up? I think Sarah's angered us still. I still don't like dental schools, so that's good. Nothing's changed for me. What about you, Kyle?
I think you supported why we don't like dental schools even more. They have not redeemed themselves in any way from this conversation. So
definitely not.
And if there's any administrators that want to come on to our Lonely podcast to talk about it and defend themselves, please have them come on. Because
email. What's our email?
Oh yes. RealDentist with an S at gmail.com. RealDentist with an S at gmail.com. Please email us.
I do feel like that you have ones who agree with you. I was working with a resident the other day and he goes, I wouldn't hire a recent grad from your school. He goes, they haven't done nearly enough.
Yeah.
Because they did. Yeah. They changed the requirements for graduating, and it's even less now. And he's like, no one's ready. And now you consider the fact that for 4 or 5 months, these students that were in clinics weren't in clinic, and so their hand skills, they're still going to be expected to meet those requirements, which aren't even that many to begin with, and be expected to be able to do them and pass their boards and move on. And it is a little worrisome.
What I want you to do, Sarah, and this is like we've been doing really well with the teasers. So I want you to find somebody that's up and coming fourth year, and I want them to try to come on the podcast, so we can talk to them about what their expectations are to graduate, right? Mm-hmm. And if they feel like they're ready, because we don't want to talk for them. Kyle and I know they're not ready, right? But there are people that don't believe that they're not ready.
And we'll keep them anonymous too. If they want to stay anonymous, we'll keep them anonymous. We all understand. Hey, I rubbed some people wrong in dental school the wrong way, and you worry about graduating and stuff, and fine keeping people anonymous.
We are not going to ever incriminate anybody on this podcast. One thing we're jerks when it we don't care about us. Like we graduated, right? Like what's the patient not going to come to me? Okay, moving on, right? But
dental school's not getting any more money out of me, I can say whatever I want. They can't take my degree from me at this point.
See how bitter we are? Old bitter men.
Well, then in that case, blur my face, change my voice, call me Tara. You know what?
Listen, we don't have the technology for all that. Calm down. You're already here. You screwed up already. But for anybody else, but no, honestly, we want to try to get people to come on because we want to get other perspectives. We joke around and we have a good time with this, but we want to get other perspectives because there are up and coming dental students that we already interviewed, the ones that are about to start school, and they need to know what they're getting themselves into.
Yeah,
they need to know what's going to be the challenges that they got to get over, and it's not all bad because I do believe, like you said, the dental schools were just like any private practice, like Kyle and myself, we were all trying to figure it out, right? And so you can't be mad at anybody for trying to figure it out. There's a lot of changes that should have come about, right? After we kind of got through the year, we should have said, okay, this worked, this didn't work. Let's get rid of the stuff that never worked in the past, and let's focus on the stuff that did work. And if that didn't happen, then they're assholes, and they didn't learn anything, right? COVID should have taught us a lot of things, right? And one is how to adapt and how to change and basically learn to be better. But not everybody got that experience, right? Not everybody got that lesson. So again, we joke around and stuff, but I do believe that Kyle and I are very honest when it comes to it. Sometimes people don't like that, Kyle. And that's probably why not a lot of people come to our podcast. But one thing we are is very honest.
Yeah, try to be. Yep, absolutely.
Right? But go ahead, Kyle. Let's finish up here, man.
Yeah, I thank you so much for coming on for us, sharing your experience, and would you like to share your email if somebody wanted to reach out to you?
Sure. Yeah. So it's just sara.galko@gmail.com.
Perfect. Yeah,
it's good to use the Gmail one so they can't monitor you at Pitt on
right.
what they're actually saying. It's smart.
Yes, there's no snitches, and if there is a snitch, don't tell them they can't come on our podcast. We don't do snitches because they're not going to report us.
Disclaimer at the bottom of this help wanted ad.
Right? No, they're not going to snitch on us. Oh, do you remember the Pitt students, Dr. Aka and Dr. Dumper? Do you remember them? They're assholes still. I'm like, yeah, we never changed. I don't know what you got at that snitch.
Maybe they'll put little X's over your faces and
right.
Your graduation pictures.
That is true, Kyle. We probably don't exist in the database now. But thank you so much for coming on. We definitely appreciate you. Go get your steady on so that you don't blame us for anything for not getting an A+. Go get your steady on. Okay.
Sounds good.
All right. Thank you guys.
See ya.